Pearl Center of Hope, a long-standing, not-for-profit community organization in the Commonwealth of Virginia, in collaboration with Sexual Assault Response Team of Petersburg, Virginia, Heaven Sent Outreach Ministries, the Organization for Women, the Rape, Abuse, and Incest National Network. Through the integration of education and supportive professional development and a faith-based Christian approach, Pearl Center of Hope aims to educate the general public, law enforcement, social services, and healthcare providers to the existence of human and sex trafficking in our area and expand the limited resources to empower those individuals that were once victims.
Human trafficking. It's illegal. It's wrong. It's just wrong. It's prostitution. I don't understand how people can take on such an act against their own will, for their own sexual satisfaction or money gain. I mean, it's just wrong.
Human rights groups estimate that there may be between 12.3 million and 27 million individuals enslaved in forced sexual servitude at any given time. The United States Federal Bureau of Investigation estimates the annual revenue generated from human trafficking exceeds $9.5 billion. With such a high yield in income, it was concluded that human trafficking is the second largest criminal industry in the world today.
The closest crime would be prostitution. I mean, you're taking these people against their own will. Some people, they want to, and it's just sad that they have that mindset. It's just wrong. It's prostitution. It's illegal. And I say it's as closest to kidnapping. I mean, it's kidnapping. You're taking these people away from their rights, their wills, their homes, their loved ones, those who, they don't have a say. That's the sad part about it.
The purpose of this project is to develop a training program for professionals who are likely to come into contact with sexual trafficking victims. The program aims to increase the skill levels of professionals to better identify the warning signs of a potential human trafficking victim. The training program will focus on teaching specific skills to law enforcement, social service workers, and healthcare providers so that they will be able to identify a potential human trafficking situation.
Pearl Center of Hope is a nonprofit organization. This organization helps individuals as well as their families who have been victims but became survivors of something as traumatic as human trafficking, who have been sexually abused or a part of domestic violence. I also know that this organization specializes in taking unique approaches in all cases to help make traumatic, extraordinary and permanent changes, impacts on people's lives. Pearl Center of Hope is already helping the community. This is here in Petersburg. You don't see a lot of promotions of different organizations here or there. This is an organization that I know for sure is already helping the community by offering additional services that help people become employed. They offer training and things as far as transportation, GED preparations, and it's just an awesome organization.
I am Karen Gale, the founder of Pearl Center of Hope, and I too am a survivor of childhood sexual abuse.
Pearl Center of Hope is a multidisciplinary not-for-profit organization preparing to offer mental health and substance abuse services to the communities of the city of Petersburg, Virginia. Pearl Center of Hope is set to provide culturally client-centered services to victims of domestic sexual violence and human trafficking. Our focus is to provide cost-effective and quality treatment. As our mission presents itself, we seek to create, promote, and maintain a positive customer relationship with our clients, associates, and staff, and our community. Through holistic measures, we strive to enhance a coordinated community response to mental health and substance abuse addiction care for children, adolescents, and adult survivors, utilizing a service system that emphasizes trust, respect, confidentiality, and compassion. Together, we are inspired to serve Petersburg, Chesterfield, Colonial Heights, and Chester. We are a new company seeking to create a buffer between the operations of existing full-service mental health and substance addiction treatment centers. We are an active affiliate of the Virginia Sexual and Domestic Violence Action Alliance, National Organization for Women, and the Rape, Abuse, and Incest National Network. Currently, we are developing partnerships with Intercept Youth Services, Virginia Department of Social Services, and Petersburg Police Department Victim Witness Program and Sexual Assault Response Team. Our objectives are to continuously develop, strengthen, and improve services offered by Pearl Center of Hope. We will develop and maintain strategic alliances with major behavioral health managed care companies, identify and develop strategic alliances with community human service and addiction agencies, identify and foster strategic alliances and network with community medical group practices, identify and implement a billing system 2 months prior to our starting date, and we shall hire 80% of staff 2 months prior to starting date. We will arrange working capital for the initial phase of this turnkey venture. Our second objective is to strengthen the Pearl Center of Hope commitment to excellence. We shall enhance customer service by offering 3 in-service trainings related to client satisfaction with treatment, accessibility, and staff-client interactions. Continuously assess referral-based satisfaction through the use of a referral-based satisfaction survey, and continuously assess client satisfaction from 3 perspectives: accessibility, environmental factors, and treatment-related factors. We are committed to quality mental health care that is provided in a collaborative effort with consumers' overall health strategies and an array of medical services. The key to success for this project includes an ability to transfer existing hospital behavior contracts to the Pearl Center of Hope, credentialing clinicians in a timely manner, obtaining initial working capital. We are further committed to the philosophy that we exist for the customer client. Pearl Center of Hope is a privately owned nonprofit Section 501c3 incorporation formed to prioritize, manage, and offer mental health and substance abuse services to victims of sexual domestic violence and human trafficking in the city of Petersburg. The founding president will manage the company. She has an accumulated 20 years of administrative, management, and clinical experience in the human service and behavioral health industry. Her management philosophy is based upon open book management, shared responsibility, and mutual respect. Pearl Center of Hope organizational structure is based upon a shared service model that involves transferring responsibility for certain activities from within to separate shared service units that focus specifically on a few narrow areas of responsibility, pooling resources across organizational activities, thus being able to deliver services efficiently and effectively. Since the company is organized as a shared service model, relationships will be a key variable in setting the direction of Pearl Center of Hope. There will be an advisory board composed of a minimum of 4 individuals in the field of behavioral health, managed care, organizational dynamics, and consumer satisfaction. An advisory management group consisting of Pearl Center of Hope staff will meet on a regular basis to review the final structure, identify customer relations issues, and develop future goals for growth, marketing, and sales. The group will be assigned the task of developing a plan to implement and integrate a continuous quality improvement component and culture into a private practice shared service model. A customer relations committee will be formed to brainstorm, formulate ideas, plan, and implement activities to enhance levels of satisfaction among all customers. Virginia statistics are rising. Virginia is a major receiver of victims who have been trafficked. In 2015, Virginia was the 9th ranked state for newly transported victims, with many of the victims forced into sex trade. Recent estimates show that in 2015, the National Human Trafficking Resource Center received 21,947 calls, 1,535 web forms, and 1,275 emails. Additionally, the Be Free text line received 1,472 text messages. In the United States, Virginia is among the top destination spots for this crime, again ranking 9th overall. The scope of human trafficking is very complex and it's an issue that is often overlooked. Between 2007 and 2015, human trafficking operations were found throughout Virginia. While incidents of forced labor may be widespread, from 2011 to 2013, nearly 400 victims of sex and labor trafficking were identified by law enforcement, social services, and other organizations in Virginia's Eastern District region. In Virginia, the National Human Trafficking Resource Center in 2016 reported that 3,074 potential victims of human trafficking were identified between January 2007 and December 2015. The Northern Virginia Human Trafficking Task Force reported these trafficking statistics for our area from October 2013 through January 2015. 290 victims were totally identified, of which 47 were minors and 243 were adults. 115 victims were recovered and 94 identified suspects. Northern Virginia has become one of the top 10 teen trafficking areas in the nation. Victims of this crime need assistance. Victims identified in Petersburg and throughout Virginia are suffering from forced labor by being subject to physical violence, threats, and sexual abuse. As a result of these crimes, this area has seen an increase in mental health and behavior disorders, most notably PTSD, leading to higher suicide rates. We seek to provide an array of quality mental health and substance abuse addiction services. The service population includes people of all ages. Mental illnesses, according to a standard definition, are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, and daily functioning. Mental illnesses take many forms and range in severity and suffering. They include anxiety disorders, bipolar disorders, borderline personality disorders, depression, eating disorder, post-traumatic stress disorder, schizophrenia, and schizoaffective disorder, among others. According to the Federal Substance Abuse and Mental Health Systems Administration, 17.5% of Virginia residents aged 18 and older had any mental illness in the past year. The state percentage was only slightly below the national average of 18.19%. Children, of course, experience mental health problems too. National prevalence rates suggest that in Virginia, there are between 85,000 and 104,000 children and adolescents ages 9 to 17 who have a serious emotional disturbance. Between 47,000 and 66,000 of these children and adolescents are extremely impaired. In 2013, suicide ranked 11th for cause of death among Virginia residents and was the third leading cause among 10 to 24-year-olds. 1,047 Virginians died by suicide in 2013. The South Side region had the highest suicide rate at 19.3 per 100,000 citizens in 2013, while the Northern region had the lowest rate at 10.1 deaths. In Virginia, 23.7% of all inmates in local and regional jails, or 6,322 people, have a mental illness. For 2012, the total cost of mental health treatment in Virginia jails was estimated at $13.3 million. Pearl Center of Hope services include psychotherapy, substance abuse, and contracted mental health services. A multidisciplinary staff provides quality treatment of mood disorders, anxiety disorders, ADHD, behavior disorders, PTSD, stress management, and substance abuse disorders. There are 4 components of Pearl Center of Hope that interact closely with each other and also with the consumer's primary care physician when appropriate. The philosophy of treatment recognizes the totality of the individual in his or her life situation. This includes the interconnection of multi-dimensions from biomedical to spiritual, as well as external relationships of the individual to the family and larger social groups. Our first is psychopharmacology. This service is provided by licensed and board-certified psychiatrists and certified nurse specialists. Persons utilizing this service may or may not be in therapy, but need medication to stabilize the presenting symptoms and to facilitate a return of the person's previous level of functioning. All age groups are treated. The average number of sessions is 10 per year. Treatment is tailored to the needs of the individual and guided by an individual treatment plan based on a comprehensive biopsychosocial assessment of the individual and their family, if appropriate. Rates are contracted. Psychotherapy. This intervention is provided by independently licensed certified nurse specialists, psychologists, licensed mental health counselors, and licensed independent social workers. The format of these services are individual, couple, family, and/or group sessions. All age groups are treated. The average number of sessions is 8 per year. Treatment is tailored to the needs of the individual and is guided by the individualized treatment plan based on a comprehensive biopsychosocial assessment of the individual and his or her family, if appropriate. Rates are contracted. In our substance abuse and addiction treatment centurions provide professionally directed evaluation, treatment, and recovery services to persons with substance-related disorders. Interventions are provided by licensed independent practitioners and/or certified alcohol and addiction counselors. These services are provided through individual and group modalities. The program consists of a 4-week program that meets 9 contact hours per week. Services are designed to treat the individual's level of illness, severity, and to achieve significant changes in an individual's addictive behavior. Treatment is tailored to the needs of the individual and guided by an individualized treatment plan based on a comprehensive biopsychosocial assessment of the individual and his or her family, if appropriate. Rates are contracted. In Pearl Center of Hope contracted services provided to consumers within this category are generally provided off-site at another facility. The services are provided with associated staff and billed via the center at contracted rates. Services include consultation, psychotherapy, psychopharmacology, and addiction services. Pearl Center of Hope will focus its market activities on the communities within the city of Petersburg and county of Chesterfield. The market for behavioral health services is healthy. If we are to grow, we must market our services aggressively. Our referral base will primarily be driven by managed care companies, Medicare and Medicaid, indemnity products, and self-payers. Focusing on and identifying the needs of these referral sources is critical for our growth. Additionally, there is significant population growth in the city of Petersburg, and this growth is projected to continue over the next decade. We have identified significant aspects of services to be offered by Pearl Center of Hope. Women, children, and adolescent services are in greatest demand by all referral sources. This gives strength to the 4 segments of our delivery service system, which address these needs. To identify the principal behavioral health competitors within the city of Petersburg, it is important to have an understanding of the behavioral health industry as it has transformed. There are primarily 4 types of behavioral health facilities: psychiatric hospitals, residential facilities, outpatient group practices, and solo practices. The primary competitor of Pearl Center of Hope is outpatient group practices. These practices can further be categorized as public, not-for-profit facilities and for-profit private practice facilities that include homogeneous group practices and multidisciplinary group practices. Pearl Center of Hope will provide quality, accessible service. The key to differentiation is to promote and evidence the mission of the Pearl Center of Hope to our customers in a meaningful and understandable manner. It is clear that we will not be able to compete doing business as usual. Our approach will be customer directed. Our customers will be able to discern our intangible as well as our tangible benefits. Our dedicated focus on all our customers will place us ahead of our competitors. When compared with all competitors, Pearl Center of Hope stands out in several aspects. Environmental aspects, Pearl Center of Hope will be managed care friendly. We shall provide prompt and accurate information as well as good communication. Pearl Center of Hope has a shared treatment philosophy. Our services are accessible and cost effective. When marketing our services to managed care companies and preferred provider organizations, we take into consideration their needs. For example, group versus individual treatment, family versus individual treatment, after-hours accessibility, access on weekends, use and tracking of outcome measures, and customer satisfaction. Our value-added customer contact. Pearl Center of Hope may provide free phone or face-to-face contact with the therapist prior to treatment as a means of initiating a therapeutic relationship. Location and ease of access to facility. Pearl Center of Hope is easily accessible by both automobile and public transportation. It is accessible to the physically challenged and there is ample free parking. Promotion, our customer first philosophy, will help attract new customers and maintain existing ones. Self-assessment. A major thrust of Pearl Center of Hope is to continuously self-assess our mode of operating in order to evaluate how user-friendly Pearl Center of Hope is for clients, referral sources, payer, staff and associates, and others. Integrated delivery system. Pearl Center of Hope has understanding and willingness to work closely with other healthcare providers. We shall become affiliated with an integrated health and behavioral healthcare system encompassing inpatient, partial, and outpatient services. Our promotional strategy will include participation in activities related to treated disorders, developing a brochure, logo, and business cards, network with healthcare providers, community agencies, and state agencies, media advertisement, follow-up letters to referral sources. We'll offer informational workshops to the public, network with the media, and join small business groups and organizations. Our marketing strategy shall include to target marketing of our services with an emphasis on customer-driven quality service, building a relationship business, focusing on 5 behavioral health payers, identify and build a niche market. Marketing tools would include direct mail, print and audio advertising, public speaking, and relationship building with identified managed care corporations and persons. Our competitive edge will be our associates and staff affiliations. Our associates and staff spread the company proposition. Our mission is to meet and exceed customers' expectations. Our affiliations with medical group practices will allow us to interface easily with a strong referral base. Hard work, integrity, accessibility, experience, quality service, and customer satisfaction are the factors influencing our competitive edge. When a customer calls Pearl Center of Hope, they will get a real person, not a voicemail message. Pearl Center of Hope will operate under the following assumptions: that the current climate for these services will continue, behavioral health contracts will be transferred to Pearl Center of Hope without difficulty, Pearl Center of Hope clinical associates will be credentialed in timely manner, our staffing patterns and facility will be able to handle the projected growth. A mutually agreed upon plan will be devised to prepare for the transition of clients. It is our goal to enhance our image and reputation by being responsive, accessible, and by providing quality treatment. By building relationships, we will cultivate our image with case managers and network managers of identified managed care organizations. The key of fulfillment will be provided by the philosophy and principles of the business. The core values are customer focus, quality treatment, and professional expertise, as is evidenced by the associates and staff performance, compassion, trust, and hard work. If Pearl Center of Hope is to sustain its growth in other capacities, we must continuously strengthen our customer relations and identify their ongoing needs. We will watch closely for industry trends that may impact our delivery service system. Our energies will be focused on creative problem-solving solutions in how we deliver our service and how we reimburse our associates and staff for their hard work. It is our duty as Pearl Center of Hope Incorporation to create a better world for sexual domestic violence victims. We strive to bring awareness and justification to this issue in our community.